All right, welcome. Today, we're going to dive into something pretty cool, the simple yet super insightful tests doctors use to check up on our nervous system. We're not talking about fancy, high-tech scans here. Nope. These are hands-on checks that tell us a ton about how our body's internal wiring is doing. So, let's jump right in. Think about it. How can you touch the tip of your nose with your eyes closed? It sounds so easy, right? But that one simple action, it's like a little miracle of coordination we totally take for granted. It's proof of this huge, hidden network inside you. And today, we're going to learn how to eavesdrop on its signals. And that network? Yeah, that's your nervous system. You can think of it as the silent, high-speed operating system that's running your life in the background 24/7. And these exams we're talking about, well, they're basically the diagnostic tools we use to see if that system is running smoothly. Every single moment, your brain and your body are having this constant back and forth conversation. A neurological exam is really just our way of listening in on that chat. And that's what we're going to do. We're going to decode that conversation, starting with the very first piece of the puzzle, how our body even collects information from the world in the first place. Through our senses. All right, first up, decoding your senses. Let's dig into how your brain takes all that raw data and turns it into, well, life as you experience it. Okay, so this is a really crucial difference to get. On one hand, you've got primary sensation. Think of this as the raw data, feeling that something is touching you or that it's hot or cold. But then there's cortical sensation. That's your brain's interpretation. It's not just feeling the touch, it's knowing where you were touched or what that object is just by feel. Now, if your primary senses are working fine, but you can't interpret what you're feeling, that can actually point to an issue in a specific part of the brain called the parietal lobe. That's the part that's supposed to be processing all this sensory info. And some of our most important senses are totally internal. Take proprioception. It's often called our sixth sense, and it's this kind of magical ability to know where your arms and legs are in space without even having to look. It's the absolute foundation for every coordinating move you make. So, how do we actually test a primary sense? Well, here's a classic example. A doctor pulls out a tuning fork. And it's not just any tuning fork. This specific frequency is chosen because it tests a very particular nerve pathway that runs up your spinal cord. So your ability to feel that buzz from the moment it starts to the exact moment it stops sends a super clear signal about the health of those specific nerves. Okay, so now let's see how all that raw data builds into something more complex, cortical sensation. And stereognosis is the perfect example. This is where your brain basically has to act like a detective. It takes all these little clues from your primary senses, like texture, shape, temperature, weight, and puts them all together to figure out exactly what's in your hand. And that's why a doctor might ask you to do this. Close your eyes and then try to identify a common object they place in your hand, like a key or a coin. It seems so basic, but it's an incredibly powerful way to check both the raw sensory input and your brain's ability to process it all. Okay, so we've talked about how our body gathers all this information, but what happens next? How does the brain actually use all that data to create smooth, coordinated movements? Well, for that, we need to meet the brain's coordination center, the cerebellum. I love this analogy. Think of it as the maestro of an orchestra, making sure every single muscle plays its part at exactly the right time and with just the right amount of force. And just like with a real orchestra, when the maestro is a little off-key, you start to get errors in the performance, in this case, in your movement. For example, ataxia can make your walk feel really unsteady, kind of wide-based. Dysmetria, that's when you can't control your range of motion, so you might overshoot a target, like when you go to grab a glass and knock it over. Each of these signs tells clinicians a very specific story about what's going wrong in the coordination process. So how do we actually test this maestro? Well, you might be surprised. It's not with a brain scan, at least not at first. It's with these really elegant physical tests designed to challenge the whole coordination system. Hey, remember that question from the very beginning? This is it, the finger-to-nose test. It looks so simple, right? But to do it smoothly, your cerebellum has to perfectly coordinate the timing and force of muscles all the way across your shoulder, your elbow, and your wrist. If you overshoot or undershoot, or if a tremor starts to appear as your finger gets closer to your nose, that's a really clear sign of either dysmetria or what's called an intention tremor. Okay, so moving with precision is one thing, but what about something even more basic, like just standing still? How do we not fall over?
That requires this constant, subtle symphony of tiny adjustments, and guess who's conducting it? Our maestro, the cerebellum. And to check that, we have something called the Romberg test. Honestly, this test is a cornerstone of the neurological exam. It's just so simple but brilliant because of the powerful information it gives us. And the way it works is by systematically taking away sensory inputs to see how your body copes. So here's the key idea you need to understand, the 2 out of 3 rule. To stay balanced, your brain needs reliable information from at least 2 of these 3 sources. Your vision, so seeing where you are, your proprioception, feeling your position through your feet and joints, and a healthy cerebellum. The genius of the Romberg test is that it strategically takes one of those pillars away, your vision, by having you close your eyes. And this is where the test really shows its power. Look, if you're wobbly even with your eyes open, the problem is probably with the cerebellum itself. The maestro is off. But if you're perfectly steady with your eyes open and you only start to sway and lose your balance when you close them, that points to a problem with proprioception, with your sense of position. Why? Because you've lost your sensory input, and now you've lost your visual input, leaving only one pillar standing, and the whole system fails. This is such a critical distinction because it tells doctors where to look next. A sensory problem might point them towards something like a vitamin deficiency, whereas a cerebellar problem sends them looking at the brain itself. So let's pull all this together. What are all these little taps and vibrations and balancing acts really showing us? They reveal the incredible power and, honestly, the elegance of a good, old-fashioned, hands-on physical exam. It's so important to remember these aren't tests you can pass or fail. Think of them as a conversation with your nervous system. The tuning fork is asking, hey, can you feel this vibration? The Romberg test is asking, how's your balance when you can't see? And your body's responses, well, they're the answers. And really, that's the big takeaway here. Long before you get to any expensive high-tech imaging, these simple, elegant actions, a touch, a vibration, a balancing act, they give us this powerful, non-invasive window into the health of your brain and your spinal cord. They're the first and often the most important clues. So as we wrap up, I'll just leave you with this question. What everyday miracle is your nervous system performing for you right this second? Maybe it's the tiny adjustments keeping you balanced in your chair, or the precise coordination that's about to let you reach for your phone. It's this silent symphony happening all the time. Thanks so much for joining me.